At Pinellas Family Dental in Largo, implants are the recommended standard of treatment for the replacement of missing teeth. Both doctors Amy and Don Vespa place implants and restore teeth on implants. In addition, a periodontist works in our office and is capable of handling complex implant cases. Dr. Paul Bevins is the periodontist who works with doctors Amy and Don Vespa to perform periodontal and implant placement procedures. As a dental specialist with decades of experience, Dr. Bevins' close collaboration with the Vespas ensures their patients have the highest quality results.
The advantage of an implant versus a fixed bridge, which used to be the conventional for replacing a single tooth in an arch, is that an implant is more like a natural tooth. You can floss between the implant crown and the adjacent teeth. You don't have the blockage and the difficulty of oral hygiene that you used to have with fixed bridge work. So it really has an advantage. The second advantage, of course, and the big one, is that you don't have to touch the adjacent teeth. Where previously, when you did fixed bridge work, you would cut down the tooth in front, the tooth behind the space, and form the bridge. So you're cutting down sometimes teeth that are with no filling. In dentistry, there's an emphasis on conservative treatment. We try to do things that are less destructive and less potentially damaging to teeth, and implants give us that opportunity especially when there's single missing tooth. The cost of implants, they are costly, but in comparison to, let's take an example of a fixed bridge. And if you had a single missing tooth and you were doing a 3-unit fixed bridge, which means that you're going to crown 2 teeth and have an artificial tooth joined between them, the cost of that bridge is equivalent to a single implant to replace that same tooth, because you're not doing those 3 crowns, or the 2 crowns and artificial tooth. You're doing the implant and a single crown. So the cost actually for that circumstance is very, very compatible with doing a fixed bridge, which is one of the other options. So, if you really look at it, it's not terribly costly, more so than conventional treatment that it was in the past. The real beauty of implants is the ability to stabilize fixed or full dentures, especially the lower arch. In the lower arch, the full denture is really not a good appliance from the get-go. There's nothing to really retain it. It just sits on a ridge. If the ridge is adequate, you're going to have a fairly stable appliance, but if you have a very narrow ridge, or if you've been wearing a denture for a number of years and that has narrowed your ridge, you really don't get a lot of stabilization in the lower denture. By placing a couple or sometimes 4 implants in the lower, you can put attachments on the base of the denture and snap the denture onto the implant and have a stability that it would be sometimes even quite hard to get the denture out. So it really can make a tremendous change. You can't believe the smiles that some patients leave with when they've got that circumstance. They have a denture that doesn't fit well, and they come in and get a couple implants, and it snaps the denture into place, and you can't believe how happy they are. It really changes their function and changes their life, really.
If you're considering implant treatment, Pinellas Family Dental will give you the careful and considerate attention you deserve as you gather information and select among the treatment options that are most appropriate for you. Call our office to schedule a complimentary, no-fee dental implant consultation and learn what is possible for you.